Okay, hi, how are you? I'm Dr. Jimenez. I'm a board-certified family physician, a fellow with the American Board of Family Practice. I retired when I was 40. I started developing websites very early in life and decided that I was going to travel the world, only to find out that I really love what I do. And I came back to work, and I started a company called HealthCare Alert, which is a mobile health company. We launched this product. We're in phase 2, 2.5 years. We have a 5-year, 8-year project. We launched this project in Barcelona, Spain at the Mobile World Congress 2 years ago, and we've been there ever since. So I'm here to tell you a little bit of background with me. I worked in the ER for 10 years, and one of the things I've noticed is I noticed healthy people getting injured and sick, and this really, really bothered me. So I wanted to do something about it because I met many people who are very concerned about their health, who are doing yoga, eating raw food, and still getting injured and sick. So I found out very quickly that distance matters. Distance matters. Proximity matters. And we're at an age now we can actually do something about that. I don't know if you can see this, but I'm sorry if I don't have great images. I apologize for that. But this is from the Center of Disease Control, and this basically is a chart of what the top 10 causes of death for all of us, 18 to 65 and older. And you'll find that there are a lot of people that die of from unintentional injuries or accidents that are ranked in the top 5, and homicides. I'll give you better charts here. This is accidents, unintentional injury. You can see that it ranks number 1 for ages 25 to 34 years of age and 35 to 44, and you can see it's still hovering around even in over 65. You can see that the unintentional injuries, this is from the Center of Disease Control, continues to be a continuous about 5%, 5.5%. Hasn't changed much through the years. These are the top 10 causes of death in the United States from the Center of Disease Control, and you can see that accidents ranks number 3, and which is a lot of people are surprised to see that. You can see here the average age rank death between ages 18 and 65. The third cause of death is unintentional injuries, accidents, and number 9 is homicide. Causes death by race. You can see that Hispanics have number 1 in an intentional injury, and number 2. Blacks are in the inverse. Whites or Caucasians, unintentional injuries is number 1, and number 4, homicides ranked number 4. And Asian Pacific Islanders are ranked where unintentional injuries number 1 and homicide number 3. So you can see what I'm trying to show you, that this is important information. A lot of people don't understand the importance of this. So what we've done is we started mapping the United States into clusters. And this is an example of a cluster. This is a cancer cluster. The highest percentage of cancer is in red. So we know that environment plays an important role in, for some reason, we don't know all the answers right now for why people are getting cancer. And there are actually zones or cluster zones that have this. What I'm mostly interested in is unintentional injuries and homicides. This is a map that we're doing. We're in phase 3, making maps. This is my hope. If you can imagine, this is my thinking. Imagine Tom Cruise in a future car, and he's about to venture and to go dinner, say in South Beach. And so we like to give him the probability where he should go eat dinner and where he should park his car to have the less chance of having an injury or being robbed or being killed, and wherever you're at. And you can see here, this is a cluster map here, and you can see these two areas really high with assault, theft, auto theft. So we want to avoid this area. Even though you might have a nice restaurant here, you might either be aware of the situation, limit your time in the situation. Maybe you don't want to be there at a certain time, but awareness is very important. And so basically, this is what we've done. Again, this is still in early phases, so we're not there yet. It's going to take time, as you guys know. It's like building. I always tell people it's like building an Empire State Building. You have to start somewhere, and this is where we're at now. We categorized these clusters, and we're just experimenting with them. This is an example of augmented reality. I'm about to venture into downtown Miami, and I'm in South Beach right now, and I just wanted to check out the city over there. It looks pretty nice, and I wanted to know whether or not I should go there. So I panned my iPhone, and I saw that this is one of the most dangerous cities in the country, and this gave me this stat. So this will give me information. Just either I not go there, either I won't go there at night, or maybe I shouldn't wear my gold Rolex. I mean, this is something you should think about. This is another situation. I was sitting at Starbucks in South Beach, and I was surprised to see that there's 3 threats here. And here there's a raccoon that's raccoons in this park here on Ocean Avenue that has rabies. So you don't want to feed these animals. These animals are being fed, by the way, by the public. One of the things we could do here too, if you have a threat and you see a threat, you can there's a social media we built into it. So your picture's there. There's a date that you've commented on it, and you can make comments about this particular threat, and you can interact with your community. So this is kind of like a community watch. So if you're really into your community, you're very proudful of your community, and you really want to interact with other people in there, you can actually interact and discuss certain threats. If the threat, unfortunately, in this country we're doing pretty good on monitoring these threats. Unfortunately, other countries don't have these threats. So you can add a threat if you wanted to. So if you're in a particular situation, like I got this idea, believe it or not, from a person in Japan who was going around checking the radiation contamination in his area, and it wasn't being properly documented by the government, and he was tweeting this stuff. I don't know if you guys remember that. So I wanted to help him and say, we're actually, Doctors Without Borders is using this right now. We're working with them. He'll be able to actually go to this location and warn other people that there is contamination in this particular area. And what we have in our application is we have a push notification. So when this person goes into this threat, that push notification will come up on the iPhone and say, you've just entered a zone of radiation contamination, and then we will give recommendations on what to do. People ask me, what do we do with the information with this? There's a moderator that gets this information, and we try to put it on the map as soon as possible, usually within 1 hour, but we have up to 48 hours to put it up. This is just another. We're doing bed bugs just for we're categorizing threats into 3 categories. There's an acute threat, like a bomb threat that's occurring right now. We need to leave the building. The information has not been released yet. and you need to do something quickly. There's subacute threats where the information has been disseminated, but hasn't really got to the embassies yet or to the governmental websites and or the news stations. And there's the chronic threats, or the threats that are known. So we were. This is bed bugs. Bed bugs are just not a big threat. It's not really harmful, but you know, this is a comment that I made here. The application is free. I mean, there's nothing much else to talk to you, but I would love to have some questions if anybody have questions here.
And if you have questions, if I may, if you don't mind coming to the microphone, or if you could repeat their questions for people
Okay.
watching the stream.
Quick question about your audience for your application. It seems like it's kind of general public. You want to talk a little bit about how you market that maybe?
That's a very good question. It's one thing I found out, and I made a fortune in websites. And one of the things I found out is you have to give it for free. You have to give this application, most applications and websites, to free to the public. It's just the way it is. So the way we're going to make money on this is. I can't really tell you the details on it because I don't have it patented yet. Most of the stuff I've showed you already, we have the patent rights. But there's a way to make money out of it. I can't really tell you. There's definitely a way to make money.
Have you addressed, it seems like medical healthcare professionals might have an interest in this. It might be valuable to them. Are you going to make a distinction between the general population, an app for them, versus you talking about doctors without borders?
Yeah, we're working with electronic medical records companies right now, and in 2014, I don't know if you guys know, everything's going to be electronic. It's actually there's a law, and so what we've done is we're working with EMRs right now, and whenever you see a physician, there's 4 assessments, and the last assessments, no matter what you come in for, if you come in for acute sinusitis or bronchitis, the last assessment is usually preventive services. That's when we come in. So what we do is we just get the user's name, we give them a password, and then not only we tell them about their threats, but we also we generate preventive services for that particular patient based on their age and gender. Now, if they answer some risk factor questions, then we can give them required preventive services that are required by their insurance, their doctor, by the Preventive Services Task Force of the United States, and we also give them preventive services based on their risk factor questionnaire. And that was really difficult to do because there's a lot of HIPAA laws, there's a lot of things going on in mobile health that you cannot do. And we built a lot of things only to get, struck down. So we spent tens of thousands of dollars only to be struck down. But we finally figured it out. It took us 2 years to do it, but we have it now.
You said that you started rolling out the app 2 years ago. What are the numbers when you first started, maybe for downloads when you first started out to where you are now? How many people are downloading it?
Very low. To me, it's low. I mean, the last project I had, we had 1,000 downloads a day. Now we're having something like 500 a month, something like that. It's very small. It's not, we haven't advertised at all. So really what we're doing is doing random sampling. We're just doing small samples of what people are doing, what they're using, where they're going to. We're looking at the utility of this application, the stickiness, what's sticky, what's not, what's important. So we're still in that stage.
I have a question. I'm playing with your app right now, and one, it seems kind of more geared toward a more tech-friendly audience, which I would just kind of default and say it's a majority of younger people. But there's a lot of questions that one has to go through in this. That I know a lot of peers in their 20s and 30s of mine have no idea if they've never been confronted with these types of issues before. So how and they're rather looks like medical questions. So how do you kind of try to get over that barrier of, say, people's unfamiliarity with maybe the diseases that they have in their family to give you the accurate data that you need to give that information back to them?
Right. That's true. That questionnaire you're looking at, we're not looking at symptoms. We don't care about your symptoms. If you have diabetes, it's too late. We won't, kind of done already. So we really want to get that person before any of these illnesses occur, or chronic illnesses before. So we have to ask you specific risk factor questions based on your family and other things that maybe your lifestyle, behavior. Unfortunately, these questions, I know that it's difficult to answer those questions. Unfortunately, the only thing we could do is when there's a question about, say, a certain cancer, say you don't know what lymphoma is, you can click lymphoma, and it'll take you to Wikipedia. And another thing too, why are we using Wikipedia? We tried using other sources like the government, Medline. I mean, there's tens of hundreds of them. And we found that most of them are not multilingual, which is a big problem. The World Health Organization only has 6 or 7 languages. So we had to go back to Wikipedia because they have, you can get the different languages. So we're looking at this worldwide. We're not just looking at this for the United States. The United States is pretty contained. It's pretty safe. But when you start venturing to Latin America, Africa, the whole story changes there.
And then I guess my next question would be, I didn't see on your slides, and I haven't had a chance on the app, do you date the outbreaks of these different things? Otherwise, I would imagine over time that if someone were sitting down, flipped up and looked around and they saw the things of rabies and whatnot, you could kind of get people to go be a little bit paranoid about venturing out. So do you kind of timestamp? Or?
Yes. We have 2 types of threats. We have permanent threats and temporary threats. For example, sexual predators, for example. 50% of all sexual predators repeat their crime. We actually did some threats around this area, so if you download the app, it's free. You can see some threats around here. There's some environmental threats around here and some sexual predators. So we notice that sexual predators move about every 2 years. So in that particular situation, we have map crawlers that do this. In that situation, we'll map crawl the sexual predator category every 2 years. Other threats are only a season, like flu, swine flu. So that threat could be 6 weeks. It all depends on that particular situation. It could be a bomb threat, which only could be 3 days or something like that. So it all depends. So we have that, and it'll disappear.
So any other questions?